кого дивитися? Туди. Не на вас, туди. Угу.
Добрий день.
Good afternoon. I want to thank everybody who joins us. My name is Olha Atamanova, and it's my pleasure to see all of you who joins us in Ukraine Media Center Ukrinform. Today is the 1st of December, and today is the World AIDS Day. So we will talk about the overall situation with AIDS in Ukraine, about the prevention of AIDS, and about the way treatment is going on. Joining us in this studio is Yaroslava Lopatina, Country Program Director for AIDS Healthcare Foundation in Ukraine. Good afternoon, Ms. Yaroslava. Good afternoon. So, Ms. Yaroslava, let's start with the situation in the regions. What is it like now, and what is the most widespread way of contraction of AIDS? Well, today Ukraine is on the second place among the countries of Eastern Europe and Central Asia by number of people living with HIV in the country. And according to the data from the Center of Public Health of Ukraine, there are 257,000 people living with HIV in Ukraine, including the temporarily occupied territories. Talking about those registered, about 160,000 are undergoing treatment, so a third of those infected don't know about their status, their positive status. They are not registered with medical institutions, and they do not receive any treatment. And that's exactly the layer thanks to whom the epidemics continues spreading. So one of the tasks of ours on this day, 1st of December, is to call to private civil sector, to public sector, and all of the citizens of Ukraine to undergo HIV testing. How does the war influence contraction and spreading of disease today? Well, the war moved many people from the places of their residences, and in Ukraine, the HIV infection was mostly spread in the southern and eastern regions, and thus many people have left those areas. Unfortunately, the war significantly affects the behavior of the people because people start thinking about their basic needs, about survival. They don't think about being tested for HIV. They don't think about HIV itself. And that's yet another factor that can in future influence our inability to slow down the spreading of epidemics. And obviously there were many hospitals destroyed, but where there is no better operations currently, the access to the testing facilities is quite good and easy. It happens quite quickly, and any person can contact civil sector representatives and undergo testing without paying. It takes only 15 minutes, so access to the testing exists. But it's necessary for the medical sector to take care of it. They should actively promote HIV testing for people who apply for medical help. Currently, the doctors who deal with HIV, they understand it. The doctors who deal with treating other infections or other diseases, they are still forgetting about the symptoms of HIV or about the fact that HIV can be asymptomatic for a long time, and they do not promote testing actively. So we should pay more attention to promoting the testing. On the other hand, the people should understand that HIV is a sexually transmitted disease. Almost 75% of people who were tested HIV positive, they contracted HIV through sex, through sexual intercourse. So any person who had unprotected sex at least once in their lives should get tested at least once. Ms. Yaroslav, we know that to cure HIV successfully, it's necessary to be properly diagnosed in a timely manner. So what is the percentage of people now who identify it in a timely manner, and to what extent we have this problem when the disease is being identified on a later stage, when there are some irreversible processes in the bodies of people? Well, it's really a problem because 50% of those who are HIV positive find out about it on the later stages when HIV or AIDS has already developed. So HIV can continue being asymptomatic for a long time. People don't even think about it, and then they start paying attention to their health condition when it seriously deteriorates. But unfortunately, people don't go to AIDS center as soon as they get some symptoms. They go to a doctor. So it's important for the doctors to know the symptoms, to pay attention to them, and even before those symptoms manifest themselves, to promote HIV testing. So we still have this problem. It's not only in Ukraine. In Europe, there is the same situation. About 50% of people who are tested HIV positive, they are being tested on the stage of AIDS. Well, we understand that HIV in our country remains a taboo topic. Many people may probably watch us, but still are either ashamed or frightened to take an HIV test. What would be your advice to those people? Well, you just have to go and take an HIV test. You can take it with a family doctor, but there are restrictions because the medical guarantees program, they guarantee HIV tests only for the vulnerable categories of population of different age. So we were questioning or surveying the family doctors, and they were saying that unfortunately the situation with COVID-19 significantly pushed this problem of HIV somewhere behind, and now there is a war going on. On the other hand, some doctors were saying that they don't have a sufficient number of quick tests, but there is such an opportunity. You can just come to your family doctor and ask for a quick HIV test. Another opportunity is to take a test in the platforms of civil organizations. Yesterday, our organization, Anti-AIDS USA Foundation in Ukraine, in coordination with Kyiv Clinical Hospital number 5, opened a wellness center. It's a place where people can take an unbiased and easy HIV test, and as well as they can be tested for other diseases which are sexually transmitted. Why is it important? Because HIV is a classical sexually transmitted disease. Other infections, they have the same way of transmission, like hepatitis B, C, syphilis, gonorrhea, and others. And sexually transmitted diseases just like gonorrhea or genital herpes or hepatitis, they significantly increase the risk of contracting HIV. This is why in a perfect situation, people are supposed to undergo a complex testing, a complex examination, so they're tested for HIV and other diseases that are being transmitted in the similar way. And the treatment of sexually transmitted diseases is the way to prevent contraction of HIV. And on top of that, in centers like that, the citizens can get advice from experienced consultants who will provide advice on prevention. For example, people get gonorrhea positive and they don't have HIV so far, but they are being explained that in case they don't change their sexual behavior to a safer one, they increase their risk of contracting HIV. So people can get advice on prevention, just like change of sexual behavior, the decrease of number of sexual partners, use of condoms, the most economic way of prevention of HIV, or otherwise people can be offered pre-contact prevention in case they cannot change their sexual behavior. They can get medicines again that would prevent HIV. So let's talk more about the testing for those who are still hesitating and don't have such experience. Well, really, some people have experience, but it turns out to be negative because previously there was only testing when the blood was drawn from the vein and people were waiting for a result for 2 weeks or maybe even 2 months. So today, those the quick tests. The laboratory test is when the blood is being drawn from the vein. It's only used for the pregnant women and for blood donors. Now we use the quick test that nobody should be afraid of. It's just as precise as the lab test, but we only draw 1 drop of blood from a finger that is put into a small plate, a test kit, and in 15 minutes the result is ready. We can find out whether people have HIV, are HIV positive or HIV negative, or maybe they are suspected to have HIV. So it's painless and very quick, and such testing can be done for other types of sexually transmitted diseases, right? Right. Now that same drop of blood can be used for a person to be tested for additional 3 infections, for hepatitis B, hepatitis C, and syphilis. So there is no need to do any additional tests. Just provide a drop of your blood from the finger. Today we use just one-time use systems. People don't even notice that they get this pinch on their finger, and in the same way in 15 minutes they may find out about HIV and even other infections. But again, I want to emphasize that those infections are being transmitted in the similar way. So if person already is syphilis positive but HIV negative, we understand that such person is in a severe need of active prevention. So like, not like, okay, no HIV, that's cool, but we have to get such person involved in prevention programs, and they exist and they are very efficient. Well, and if a person is being tested HIV positive, what should they do? Many of our audience may think that if they are being tested HIV positive, everything is real bad, the life is over. But what should people really do? Well, Unfortunately, HIV infection cannot be completely cured, but we can maintain a good health condition for HIV positive. We can compare it with the sugar diabetes. There is antiretrovirus therapy, quite an efficient treatment. People take medicines that aim against the virus directly. They still cannot get people fully get their bodies fully rid of those infections, but they allow controlling virus to such an extent that it remains in a very small amounts in the body. It does not influence the body in a negative way. The health condition improves and people can live just as long as they could live without HIV. They can continue doing the very same things that they can do. They can work whoever they want. They can get married. They can bear children, travel. The life does not change. Now there is a very efficient treatment which is very simple. Just one pill per day that doesn't have any additional effect. You just have to remember and take it once per day. And what's also important to say that the virus that becomes in such a small quantity in the body that it cannot even be transmitted to other people. So the virus is not being identified by lab methods and it's not being transmitted. So the people who undergo antiretrovirus therapy, even without the use of condoms, they cannot, it's just biologically impossible to have HIV transmitted to other persons. However, we have 30% of HIV positive people who don't know about their HIV positive status. So once again, it's a necessary task for the civil sector, for the medics, to find all the people who are HIV positive. Well, at least 95% of them are supposed to undergo antiretrovirus therapy. And thus we may demonstrate that the epidemics is under control. However, now the situation is different. The HIV epidemics is still on. Dear colleagues, do we have any questions on the floor? Good afternoon, Elena Sapko, Ukrinform. You've mentioned that we have 257,000 people which are HIV positive. And can you please tell us what was the dynamics within the last 5 years? Well, 5 years ago, the number of such people was around 230,000. So talking about the epidemics process, if the number of HIV positive citizens grows, it doesn't necessarily mean that it's bad, because we find new people. For example, there were 10 of them, we found 10 more and all of them survived, and now we have 20 survivors. It doesn't say that the picture is bad. We have to look at the distribution of those who undergo treatment and those who do not. So when we say that a third of those HIV positive in Ukraine don't undergo any treatment, this is the bad thing. So talking about mortality rate, what it is like now, about 2 to 3 persons dies of AIDS on a daily basis, and about 1,500 to 2,000 people die on an annual basis. They die of AIDS, and we have understand that if you detect the infection when it has not come to the stage of HIV or AIDS, the HIV infection will be taken under control 100%. If people are already ill with AIDS, there are no such guarantees, because AIDS can manifest itself in a number of ways. Some infections can be treated, like tuberculosis. A person can get tuberculosis and we will have to cure 2 infections at the same time, both tuberculosis and HIV. But unlike treatment of HIV, tuberculosis has a very complicated way of treatment, and if people treat if people are being treated from HIV and they don't feel any side effects, tuberculosis treatment has side effects almost in 100% of cases. Well, they can all be corrected, those side effects, but it's still complicated. And if people have resistant tuberculosis, the chances of survival fall drastically. So as soon as HIV is being detected, there is no guarantee that people can get back to normal, healthy way of life. So I'm sorry, yeah, when they are being tested positive with AIDS. So some infections, they just wake up when people are infected with AIDS. They live inside us, but since the immunity falls, such infections may affect the brain, and people start getting irreversible processes in their body. This is why we have to offer the HIV test earlier and don't always take it formally. And we should rather not look at the person as belonging to certain vulnerable categories of population by some formal indicators. Unfortunately, the representatives of vulnerable categories, they are still being stigmatized in the society, and this is why people do not want to tell about their sexual lives in order not to be condemned. So it's a huge barrier, and we as an organization, we create such spaces where there is no condemnation, where people can easily talk about their status, about their conditions, and receive aid and help. But we have to pay attention also to another medical sector. We have to promote the HIV testing without condemnation, so that people don't feel that they're being offered this HIV testing just because they are different. Well, thank you very much for joining our broadcast. Let me remind you, joining us was Yaroslava Lopatina, Country Program Director for AIDS Healthcare Foundation USA in Ukraine. And let me remind you once again, please undergo testing, find out about your status, don't be afraid, and please make safe yourself and others around you. Thank you very much for being with us today. Let's continue working together for our victory. Let's thank our security and defense forces, and glory to Ukraine.